My doctor includes me in the decisions about my care by keeping me informed about medical research, because I have a problem with one particular illness that I have to manage throughout the rest of my life. So he keeps me involved in that, makes sure that I know what he's prescribing medication for me, and updates my medication on a regular basis.
After discussions about my problems, he accepts what I am saying in that I know my own body. For example, he tends to tell me I have asthma, and I tell him, no, I don't, I have COPD, and we adjust the medication accordingly.
He always discussed with me in detail, and I can give you an example of my osteoarthritis, which I am suffering for the last maybe 10 or more years, and I was recommended both the knees replacement. I wasn't keen to go for that, and then he advised me to, yes, you can go for epsotherapy.
I find he does it very well. He asks me if I agree with his suggestions rather than just telling me I've got to go somewhere. And with the recent ENT, I have been to see 2 or 3 different specialists at his request, all of which has worked out well.
Yes, well, she discusses with me. For example, recently I had a thyroid problem, and I had to decide whether to have blood tests every year or every 6 months. And secondly, there was a possible blood pressure problem, yes, whether I would take tablets or not, or whether I would go to her regularly just to see what the pressure was. And that was good because I could make those decisions myself.
By discussing the medication he's giving me with me and the effects it will have on me, and reassuring me that it will be all right. But if I'm not happy, come back again and see him.
My doctor discusses the age I'm at and the problems I have. And I attend a diabetic clinic, and I found that the new, younger doctor is more concerned about how I feel about myself. The previous doctor or specialist saw me as a patient, more of a number than as a person. So there was a standard treatment. Whether you liked it or not, you got the standard treatment. I think the new generation of doctors is trying to fit the treatment to the patient.